I'm Dr. Neal Cayne. I'm here with Dr. Gary Ansel and Dr. Ali Amin, and we are very happy to be back live at the VEITHsymposium. We had a wonderful session on lower extremity occlusive disease and PAD, and I enjoyed both of your talks. Maybe, Gary, you could say a few words about what you enjoyed about the session and maybe a little bit about what we need over angiography when we do these cases.
Super, thank you so much. I mean, the session was awesome. We're getting much more longer term data. We're getting best CLI data, so we're getting comparison data, which is what we need. I really enjoyed the session from all that standpoint. I think the main point I had in my talk is that angiography, especially for peripheral vascular disease, is somewhat limited because of the limited angles. We have all these new technologies like IVUS, OCT, flow wires for pressure evaluation that can help us as we're evaluating both our diagnosis as well as our results.
Thank you so much, and I learned a lot from your talk. Thank you for educating me. And Ali, the 12 commandments for how to do below-knee interventions. I thought it was great. Again, I learned a lot myself, as I do in all these talks. Tell me what you liked about the session and maybe the highlights of your talk.
Thanks, Neil. So my talk was a technical talk, and I think the whole session was combined both clinical results as well as technical component. Mine was sort of geared toward everybody, whether you're a beginner or intermediate or advanced interventionist. I think hopefully you will learn something from the talk, because my job is try to provide simple techniques for these physicians to be able to go back to their institution and be able to replicate so they can have a successful case. But the whole session provides a complete guide to a lower extremity intervention, where there's a clinical data, techniques, results. So essentially we can provide the best care for our patients, and every year you come here, you learn something new, you take back to your hospital, and you can also teach your own colleagues when you go back if they're not here.
I learned a lot from this. That was a phenomenal session along with all the other sessions, and I look forward to the last 2 days of the meeting.